We now go to chromosome 22, long arm of chromosome 22, band 1, region 1, again region 1, band 1, subband 2. That's how you read this karyotype. So the incidence rate for this one is 1 is to 4,000 live births. And I presented here two clinical features. We have the DiGeorge syndrome and the Velocardiofacial syndrome. So previously, these clinical features were considered to represent two different disorders. Until recently, they were found to be associated with a similar cytogenetic abnormality that the clinical overlap came into focus. So these two, it's actually, although they have different clinical manifestation, it's just a deletion of this chromosome. Okay, chromosome 22, the long arm. So for uh, the reason why I put here schizophrenia is that it is very somewhat unique for this chromosome that some of the patients develop schizophrenia or psychotic illness, which is a risk actually if you have this kind of deletion syndrome. They also present, some of them can also present with bipolar disorders, attention deficit disorders, but we focus on this ones. So for the DiGeorge syndrome, the clinical manifestation, I put here PATCH. PATCH is actually an acronym for parathyroid hypoplasia, abnormal phases, cardiac, and thymic hypoplasia, cardiac and cleft, so this should be cleft palate, and then hypocalcemia. So hypocalcemia is the most important manifestation of DiGeorge syndrome since um, this is actually because of this parathyroid hypoplasia. So they will exhibit seizures, tetany, cyanosis. Like for the mild phase, actually this mild phase is abnormalis. Then for the thymic hypoplasia, it's actually an absence of T lymphocytes. And then patient would actually present or be, when exposed to different kind of infections, they will present with chronic inflammation because they lack T lymphocytes, which are very important for immune response. For the cardiac and cleft palate, cardiac malformations include those that affects outflow tract. For the hypocalcemia, that's what I said earlier, it's the most important manifestations. It's because of the parathyroid hypoplasia. For the velocardiofacial syndrome, I'll just show you a picture of it here. It's actually a velocardiofacial syndrome. There's a facial dysmorphism. Actually, very important would be enlarged or prominent nose, which is not actually seen in this case, but most of them will present those with velocardiofacial syndrome. And then they can either have cleft palate, or some of them would have everted lip. This one, everted lip. And then retro or micrognathia or small jaw. And some of them will present mental retardation. Okay, that's all for